Recording right now. Okay, so if it's okay, we can get started. Today is, what is the date today? December 9th. But I would like to welcome Dr. Elaine Kiriakopoulos. It's a real great honor to have her here and speaking to us today. And I'm going to do her formal introduction. And I'm just going to leave it to her because Dr. Kiriakopoulos is in Boston right now, and it's 10:30 at night. So Dr. Elaine Kiriakopoulos is an assistant professor of neurology at the Giesel School of Medicine at Dartmouth College and the co-director of the HOBSCOTCH Institute for Cognitive Health and Wellbeing at the Dartmouth-Hitchcock Epilepsy Center. Dr. Kiriakopoulos is a graduate of McMaster University Medical School in Hamilton, Ontario, Canada, and began her postgraduate medical training as a resident in neurosurgery at the University of Toronto, combining clinical training with research in brain mapping in pediatric and adult neurosurgical patients. She traveled to Boston to complete a research fellowship in fMRI and transcranial magnetic brain stimulation, TMS, at Harvard University, studying cross-model plasticity in the adult human brain. She subsequently completed her neurology residency and an epilepsy and clinical neurophysiology fellowship at the Beth Israel Diaconus Medical Center. She remained in Boston, serving as a Harvard medical faculty physician, combining her clinical neurology practice with research focused on advancing clinical imaging and EEG recording techniques to improve diagnosis, treatment, and patient outcomes in epilepsy. Dr. Kiriakopoulos has served in several nonprofit leadership roles, where her efforts have focused on accessible health education and improving systems of care for people living with epilepsy. She continues to serve on the National Epilepsy Foundation's editorial board. As the director of the HOBSCOTCH Institute, which focuses on cognition and epilepsy, her efforts will aim to expand education and supports for patients and providers, epilepsy self-management program dissemination, implementation, and research to improve health outcomes and quality of life for people living with epilepsy. So without further ado, Dr. Elaine Kiriakopoulos, thank you so much for joining us this evening.
It's really super to be here with you this evening and to share with you a look at an innovative self-management tool helping to meet the needs of people living with epilepsy and cognitive challenges. And I want to take this opportunity to thank Naomi and the Epilepsy Foundation of Hawaii for hosting tonight's webinar. We're so glad to partner with you, Naomi, to bring you an educational webinar and also an intervention that can help people to build skills, to help with challenges around thinking and memory that, often accompany a diagnosis of epilepsy. So thank you for welcoming me and then for that really nice introduction. I have no disclosures for this talk today. We have a lot to get through, so let's go ahead and get started. Let's have a quick look at how we'll spend our time together. We'll begin by considering the effects of epilepsy and its treatment on cognition. And this will lead us to discussing what it might be like to participate in an epilepsy self-management program. And the one that I'm sharing with you today directly targets cognitive challenges and is called HOBSCOTCH. And as we discuss HOBSCOTCH, you'll be introduced to problem-solving therapy and memory strategies that the program uses to help people with cognitive challenges in epilepsy. And then ultimately, we'll head towards the final thoughts around targeted innovative solutions and building skills that you can participate in to help you take control of day-to-day life. Let's quickly review what the word cognition reflects. So cognition, simply put, refers to thinking. Cognition also encompasses all the mental functions by which knowledge is acquired, retained, and used. And so it covers a wide number of functions that we all perform every day. And included under this umbrella of cognition are memory, learning, attention, language, and executive functions that the brain performs, like problem solving, judgment, planning. And it also includes things like perception and our imagination. all of these functions are carefully balanced in our brain to help us build our knowledge and understanding of the world around us through thought, experience, and our senses. Now, while some cognitive processes are carried out consciously and deliberately, others are carried out more unconsciously and automatically. And we'll take a closer look at things. So what are some of the key factors that can affect cognition or thinking in people with epilepsy? The first is ongoing seizures. The second is the underlying cause of the epilepsy. In nearly half of people with epilepsy, we can't figure out what the cause is, but it's generally accepted that there is likely some form of either brain injury or a genetic predisposition that contributes. And with advances in brain imaging and genetic testing, we're learning more and more about the underlying causes. The third key factor relates to the treatment of epilepsy, and this principally refers to what is a familiar experience to many patients, and that is medication side effects. Now, we'll spend some more time on each of these factors throughout this presentation. Throughout today's discussion, it's important for us to remember that epilepsy is a diverse disorder, that clinical outcomes in epilepsy are diverse as well. And so it makes perfect sense then that cognitive profiles, so how each person with epilepsy thinks, is also diverse. Not every person with epilepsy will have difficulty with cognition. And for those that do, the type of thinking or remembering problems that they experience can differ. However, we do know that through a large number of clinical studies and surveys done over time, they've helped us to learn that a large number of people with epilepsy do report being impacted by cognitive or thinking challenges. In a survey of 425 Europeans living with epilepsy, done by the International Bureau of Epilepsy, we learned that almost half of the group reported difficulty learning and slow thinking. And about 6 out of 10 people reported getting tired or sleepy related to their epilepsy. About 63% felt medication side effects were limiting and prevented them from achieving their goals. And more than half, about 6 out of 10, had asked their healthcare provider if something could be done to reduce the cognitive effects of their epilepsy and its treatment. We also know that both children and adults report memory and thinking difficulties frequently, and that the subjective memory complaints are more than twice as common in people with epilepsy as compared to the general population. We also know that how epilepsy affects a person's memory and thinking can be complicated by a wide variety of factors, including things like anxiety and depression and other medical or psychiatric illnesses. One very important reason for clinicians and researchers, and all of us really, to strive to make progress is because studies have shown that if a person is living with epilepsy, cognitive challenges directly impact how that person regards their quality of life. Let's talk a little bit about the cognitive function of memory, because the HOBSCOTCH program you will learn directly targets memory. And so when you ask people, both those with and without epilepsy, what they mean when they say they're having memory problems, you'll hear a wide variety of responses, and you can see some of the common things that people share listed here. They may reference misplacing items, or being unable to remember lists, or getting lost, or forgetting names as examples. People will reflect on their memory problems in many different ways. If you try to narrow things down when talking with someone, it may be that their symptoms are related truly to just having difficulty remembering. So forgetting appointments or names, or forgetting conversations, forgetting to take a medicine, or forgetting something they have already done and repeating it or going back to check to see if they actually did something. And this, of course, can bring a good deal of frustration. For some people, their symptoms seem to fit along the lines of having trouble paying attention or focusing. And what they might share is things like they have to reread pages or paragraphs that they've already read, or that they find themselves not finishing tasks, or that they leave out steps during a task and that they miss details. And often this type of difficulty will come to the surface with a poor performance at work or at school. And for some people, they share their biggest difficulty when it comes to thinking has to do with planning or organizing that can impact their memory. So they might have trouble planning time or organizing their day. They may miss scheduling important tasks. They often find it difficult to multitask or deal with a new issue when it arises. And often they express feeling overwhelmed during even a normal routine day, whatever that might entail for them. Another important thing that we've learned over time is that the correlation between self-reported memory problems and formal neuropsychology test results are low, so they often do not match. So let's take a closer look at that. And what this chart shares is an interesting comparison of the subjective thoughts of patients, so what patients are feeling, and what caregivers often share about cognition, and it compares it to what we've learned through scientific research. So often patients and their caregivers may think, my memory is fine, but research shows that those who subjectively have no impairments will often have the most impairment when they have testing done. Patients and caregivers may think, my epilepsy or treatment of it has significantly worsened my memory or concentration. And what research shows is those who worry about cognitive problems often have none on formal testing. Patients and caregivers may think, I had my memory problems before I ever had a seizure. And research has, shown us that yes, in fact, memory problems may exist even before seizures begin. Patients and caregivers may think, I can't remember what happens during or right after a seizure. And, research has shown us that we know that seizure activity can affect memory, but exactly how is still not completely understood. Patients and caregivers might think, the longer I've had epilepsy, the worse my memory and concentration have become. And in fact, research shows that memory problems can worsen with prolonged epilepsy, especially poorly controlled epilepsy. And then finally, patients and caregivers may think, my epilepsy medications make it more difficult to remember and concentrate. And what we know from research is that many anti-epileptic drugs have some effect on memory, but this tends to be less true of the newer drugs. So let's look a little further at the causes of cognitive problems. And we talked briefly about key factors that can influence thinking and memory at the beginning of today's learning. And I wanted to share with you a little more detail around some of the causes of cognitive problems in individuals with epilepsy. So to orient you to this graphic, what you're looking at is what we call in neuroanatomy a coronal slice through the brain. So if you imagine starting at the tip of your nose and going to the back of your head, making slices as you move backward like a loaf of bread, this slice would be somewhere near midway in the brain. So let's start with the rose-colored text. So structural factors, which generally speaking are largely irreversible. So structural factors can include lesions that have the potential to progress, such as a tumor or an infection like encephalitis. A person can also have stable structural lesions, however, that contribute to the problem. And these can be things like a scar caused from a traumatic head injury or a congenital malformation, something that may have come from the time of birth, from the And finally, in this column, we also have epilepsy surgery, which may contribute to cognitive issues post-operatively in some, but not in all cases. And this is really very dependent on the region of the brain and the degree of cognitive deficit already present before surgery, and any other structural changes that may be present. In the center, the navy column of clinical factors, so things to consider here are the location of the epilepsy focus, so where in the brain those seizures are coming from, the duration or length of time someone has had epilepsy, the type of seizures a person has, and if the person has had one or more episodes of status epilepticus. And in the third teal column, you see a list of functional factors which are considered largely reversible. So this includes things like anti-seizure medicines, and they're reversible in the sense that if someone were having a lot of side effects to one medicine, they could potentially try another one or adjust the dosing with the help of their doctor. Psychiatric comorbidities are treatable and potentially reversible as well. And finally, seizures and interictal discharges. So people with epilepsy frequently have what are called interictal discharges, or epileptic sharp or spike and slow waves that are seen on an EEG. And what these are a type of pathological discharge, and they're frequently seen in between seizures and occur in and around typically the seizure onset zone. So both the seizures and these IEDs are both potentially reversible with the appropriate treatment. All right, so let's move on to anti-seizure medicines. And I'm just going to touch briefly on anti-seizure medicines and cognitive functions. And that is to share that there are some medicines which are considered more or less favorable when it comes to their influence on a person's memory or thinking, or their processing speed, or their language, for example. However, every person is different, and their response to medication may be the opposite of what is listed here. So the key is, if you feel you are having side effects affecting your thinking, and you've recognized this as a problem, what you need to do is make time to speak with your doctor about that and approach a change in medication safely with their medical guidance. I want to point out, when it comes to cognition, it's not always the fault of seizure medicine side effects. And I'll share this study with you. So a study of 247 people with newly diagnosed epilepsy who had not had any medication prescribed yet demonstrated on formal testing that about half of them had memory or attention or executive function problems, even before their diagnosis. So interestingly enough, about half of the people with these problems were unaware of their deficits. So the study noted that there was a higher risk for cognitive problems if a person had generalized clonic seizures, if there was an unidentified or if there was an identified underlying brain lesion, or if the person had a lower education level. This study highlights that neuropsychological testing early in the course of a diagnosis of epilepsy should be discussed, as it can help set an accurate baseline for testing down the road if a person notes new changes in their thinking. And just to point out what you might expect, that anti-seizure medicines can have positive as well as negative effects on cognition. So if they are helping out, if they're aiding in controlling seizures and suppressing the interictal discharges, it can very much positively influence a person's thinking. Let's pause for a moment now to reflect on what we have discussed. We've gone through a lot fairly quickly. So far, when it comes to thinking, memory, and epilepsy, what things can a person do to help improve their memory and thinking? So first, monitoring their seizures and seeking treatment for uncontrolled seizures is important. Both clinical and subclinical seizures need to be treated. So clinical seizures being ones a person is aware of, and subclinical ones being ones that a person may not notice. Adherence to medicine is key. So making sure that you're taking your medication the way it's prescribed, properly, as your physician has recommended is very, very important. Remembering to keep a close eye on any other medication, not necessarily your seizure medicines, that could potentially be affecting your thinking is important as well. We also know it's important for people to take care of their general health, both physical and emotional. Finally, in thinking about taking care of doing all these different things, where can a person turn? Well, considering a program like HOBSCOTCH is a great place to start. And at this point, I'm going to transition to share with you more about self-management, epilepsy self-management, and the innovative HOBSCOTCH program that can help support you to manage all these different things and will allow you to think creatively and to come to solutions that work for you. It's a very personalized and individualized program. So some of you might be thinking, why should I consider a self-management program? What can it do that my doctor or nurse can't do? I need to yield here before I turn this corner and commit to trying something new. Let's think about this together. So sharing some background about how we have received healthcare for various conditions in general. So we've learned over many decades that the treatment in the traditional medical model, which really historically focuses on managing a specific disease condition, as opposed to managing the whole person, has proven to be both ineffective and expensive in the treatment of chronic diseases. This is, of course, because many people have more than one chronic condition, but also because competing life circumstances can impair a person's capacity to self-manage their disease. Limitations of the medical model have led to innovative, new and evolving chronic disease treatment paradigms that require for a patient-provider partnership and involve collaborative care and education in chronic disease self-management. And that's in order to ensure the best possible health outcomes and quality of life for patients. A significant proportion of unnecessary healthcare costs and poor health outcomes associated with the treatment of chronic diseases result in large part from the failure of people to effectively self-manage their conditions in response to recommended medical therapy. So if the management of chronic diseases is to be advanced, both healthcare providers and systems of care need to integrate patient self-management to increase the capacity of people by providing knowledge, resources, and skills to perform the multitasking that's necessary to self-manage their condition. And so for this to happen, it requires building on and tailoring what's already known to be effective and sharing evidence-based programs and practices within and beyond the clinical setting. So in settings like this one tonight, in the community, by working to share self-management, the possibility emerges that people will be enabled and supported to manage their chronic diseases and challenges related to them in the context of their homes and in their diverse communities, and with the help of community partners like Naomi and the Epilepsy Foundation of Hawaii. Substantial evidence of the effectiveness of chronic disease self-management programs has accumulated for several chronic diseases, including epilepsy. So interventions provided by these programs have been shown to influence a wide range of outcomes. And I'm going to be sharing one program with you this evening that targets memory and thinking. But evidence for the impact of epilepsy self-management programs has grown over the past decade, with over a dozen randomized control trials supporting the benefit of self-management interventions and their ability to improve health outcomes and quality of life. We know that in order to manage epilepsy well, a person has to juggle many different aspects of their unpredictable disease, their treatment, and the practicalities of day-to-day life, as well as medication side effects and comorbid illness. It's no small task to manage epilepsy well. And so let's talk a little bit more about HOBSCOTCH. Let's take a closer look at this program to see how it can help. I'm going to talk with you a little bit about the Managing Epilepsy Well network as well. So to advance the science related to epilepsy self-management, the Managing Epilepsy Well network was established in 2007 with support from the CDC Epilepsy Program and Prevention Research Centers Program. And the goal of this network is really to develop and test innovative self-management programs and tools for people with epilepsy and their healthcare providers. And where HOBSCOTCH fits in is it is one of the programs in this wonderful network. So you may be asking yourself, how did they come up with the name HOBSCOTCH? Well, HOBSCOTCH is short for Home-Based Self-Management and Cognitive Training Changes Lives. It's a telehealth-friendly, participant-driven, evidence-based, and adaptable program that people can do in their own homes. The program was developed by Dr. Barbara Jobst and Dr. Tracy Collar, along with a multidisciplinary work group at Dartmouth-Hitchcock Medical Center. And as I mentioned, funding for development and testing of the program came from the CDC through the Managing Epilepsy Well network. And HOBSCOTCH was created with two key collaborators who allowed components from their own programs to be adapted for HOBSCOTCH. One of the collaborators was Dr. Robert Ferguson, who created something called the Memory and Attention Adaptation Training Program. We'll talk a little bit about that in just a bit. And Dr. Mark Hagel for his work in modifying problem-solving therapy for primary care implementation. HOBSCOTCH is a self-management program designed to treat cognitive symptoms and improve quality of life while minimizing the barriers of access to care. And when we think about self-management in epilepsy, this here is a definition that was shared by one of the very early researchers in epilepsy self-management, a woman named Colleen Delorio. And the way she thought about epilepsy self-management was that, broadly speaking, it's the sum of total steps taken and processes used by a person to control seizures and manage the effects of a seizure disorder. In general, in epilepsy, self-management reflects that those steps that each person takes and how those processes are used to control day-to-day seizures and manage the effects of a seizure disorder. So really focus on those impacts. And what we know, if we think about Ms. Delorio's statement, is that in order for self-management to be successful, it involves a partnership between the person living with epilepsy, the person's healthcare provider, family and friends, and community supports as well. I want to share just a little bit of the scientific evidence behind HOBSCOTCH. And so HOBSCOTCH was first evaluated in a randomized control trial conducted at Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire. And the medical center there is a level 4 epilepsy center. And this study was published in a journal called Epilepsy and Behavior in 2016. It was done in 66 adult patients. And patients with epilepsy, with or without uncontrolled seizures between the ages of 18 and 65, were screened to see if they had subjective memory complaints. So if a person, had evidence or really felt like they were having memory complaints, then using a survey tool called the Quali-31, people were screened and they were considered for the study. Patients who met the inclusion criteria were randomized via computer. They were given a random assignment into a control or a treatment group. And what the study found was that those who received HOBSCOTCH showed a significant improvement of quality of life when compared to controls. And there was also a significant improvement in objective cognition. And this was noted most highly with the domain of attention. So people being able to think better and to pay better attention. And so here's a graph displaying results from this first study. The data are shown as a mean change from baseline. So the teal bars here indicate the group of people who received HOBSCOTCH, and the lime green bars represent the control group. And the primary outcome that was measured was the quality of life. And that was done with that Quali-31 screening tool I mentioned to you. And secondary outcomes of objective cognition were measured with something called the R bands. And that was to look at any improvement in a person's cognitive status. And finally, depression was also looked at. And what was found was that there was a significant improvement in quality of life as measured by the Quali-31 and in objective cognition as measured by the R bands. And while we did see some improvement in depression, and so in this case, you want that teal bar to be lower, and so you see how it dips below baseline. While we did see some improvements in depression, the results of this group did not reach statistical significance. A second study of HOBSCOTCH was launched in 2015, and the data collection for this study concluded near the end of 2019. And what I have here for you is an interim analysis. And so the primary goal of this study was to try and repeat our primary outcome and show that the program would have fidelity across epilepsy centers in northern New England. So in this case, it was delivered to 84 adults with epilepsy at 4 sites, so in Maine, New Hampshire, Vermont, and Massachusetts. And shown here are the interim data from this study across the 4 epilepsy centers, looking at the primary outcome of quality of life. And the teal bar represents data from HOBSCOTCH 1, and the red bar from HOBSCOTCH 2. And what's demonstrated is that across patients who received HOBSCOTCH at 4 different centers, the finding of improvement in quality of life was replicable. And so that both HOBSCOTCH 1 and HOBSCOTCH 2 demonstrated a significant change as compared to controls. And in fact, the results were even stronger in the second study across the 4 epilepsy centers. So who can participate in HOBSCOTCH? So adults with epilepsy and thinking or memory challenges can benefit from this program. We know that people have to be motivated to learn new skills and strategies when they come to this program. So coming to this program because your doctor told you to, or your husband told you to, or your sister told you to, we know that that person is not going to do as well as someone who's really motivated to come and learn new skills and comes because they want to. And so when you come to the program, you can look to try and improve things like organization. So things like remembering appointments. You can work on disease management skills. And so that's things like taking your medicines on time, making sure you get enough sleep, making sure you're exercising and have good nutrition, social skills, so working on problems like remembering names or remembering conversations. These are all different kinds of things. If you're motivated to learn new skills, you can try to tackle with this program. And so where does the program happen? It happens, as I mentioned earlier, from your home. We need people to have telephone and online access to complete the program. And how? So you can complete the program by reaching us at newprograms@hitchcock.org. And here in Hawaii, and I have Naomi's name at the end here with her email address, you would reach out to Naomi to complete the program. Let's talk a little bit about program structure. So the program is structured in 8 sessions. During the first session, you would meet with your HOBSCOTCH coach. So you have a one-on-one coach for this program. And you would meet with that person either in person or virtually. And you would spend 90 minutes together getting to know one another, doing some education around epilepsy and cognition, and also working on listing out the types of problems you'd like to work on during the course of the program. Sessions 2 to 7 are done over the phone, and they tend to last between 45 and 60 minutes. And session 8 with your coach is the final session. And during this session, your coach will help you to build a maintenance plan. So you can take any skills you learn in the program, any strategies that work for you, and carry them forward in life. And this can be done in person, virtually, or over the phone. As the participant, you'll receive a participant workbook, and that has educational materials about memory and epilepsy. It has problem-solving worksheets in it. We're going to talk a little bit more about problem-solving therapy in just a minute. And those allow you to work through different problems with the guidance of your coach. And you also receive what we call our memory toolbox of compensatory strategies. And these are behavioral strategies that are tried and true. And we'll talk some more about those. You'll receive relaxation MP3. So as part of the program, you'll learn mindfulness, doing quick relaxation with progressive muscle relaxation and breathing. And you'll also receive a day planner and seizure diary. And so now let's move from science to real world solutions and share a little bit more about the program with you and what it would be like to participate. So I mentioned to you that during the first session, epilepsy education and self-awareness training happen. And so the epilepsy education in HOBSCOTCH really teaches the basics of memory and how seizures and variables related to epilepsy can impact someone's memory and their thinking. Self-awareness training teaches people to be aware of the various external and internal factors that can impact memory and attention. Problem-solving therapy is a main component of this program, and it's a form of cognitive behavioral therapy. And what it does is it helps you to learn the skills to systematically work through cognitive related difficulties and real life problems. So it takes those problems and turns them into challenges that you and your coach will work to find solutions to, and then you'll implement the solutions. And together you'll weigh, how well those solutions work for you. And could it be really something that you could apply in day-to-day life to improve your quality of life? And then finally, compensatory memory strategies. So as I mentioned earlier, you receive a memory toolbox, and your memory toolbox is really part of your workbook. And in the toolbox, there are strategies provided that teach practical skills to help you feel more in control of any memory or thinking challenges you might have. So this is an example of what the epilepsy education is like. We talk about seizures, we talk about the brain anatomy and where seizures come from in the brain and how that might influence different types of memory. We discuss what is necessary for someone's memory to function. And so we talk about the steps of encoding. So being able to focus and attention and bring something into your brain networks. We talk about storage. So how those things that you encode are stored. And we talk about how then you go to that stored location of a memory and retrieve it. And with your coach, you'll talk about, you'll think about your own memory challenges or thinking challenges. And we know that if things get disrupted at any point, it can impact memory. So together you'll think through where you might be having the most difficulty. And why that's important is because then your coach can help lead you to strategies that target that. So someone having difficulty with paying attention and encoding might use a very different strategy than someone who has trouble retrieving memories from their storage. The learning that's done in the part of the program is very interactive, and we want to personalize it for the needs that you have. I also mentioned self-awareness training, and self-awareness training looks like this for this program. So on the left, you see a sheet where you'll take time with your coach during that first session to really think about the problems you have and list them out and divide them into those three categories of organizational skills, disease management skills, and social skills. You'll also, during the first session, receive information about this memory and attention problem experience record. And how this works is your coach will go through with you filling out this form, and you'll do this for the first week of the program. You'll take this form home with you. It's in your workbook, and you'll fill it out with the date, and then you'll also list briefly any sort of memory or attention problem you had on that day and how much the problem bothered you. You'll also pay close attention to what was happening around you. What were you doing? What were your surroundings like? Was it noisy? Was it quiet? And then finally, you'll think about what you were feeling at the time. Were you feeling anxious or tense, hungry, tired, or were you feeling pretty peaceful? Things were okay. And the reason for taking all these steps to think about the memory and attention problems you're having is really to make you more self-aware of sort of the external things, so noisiness, and the internal things like feeling anxious that might be contributing to your cognitive issues. And so a simple exercise like this can help us identify high risk situations for people and any patterns that might underlie someone's memory or thinking problems. So I want to talk a little bit about problem solving therapy because you'll be doing this from week to week, from week 2 through week 8 with your coach. And what it is a type of cognitive behavioral therapy. And it's applied to life problems that have psychological and physiologic symptoms. And it's based on a model of stress and well-being that takes into account the importance of real life problem solving. And it allows people to see their problems as challenges to be solved instead of insurmountable obstacles. And in this program, we really stress for people to be creative when they think about problem solving, because most of us, when we have a problem, have tried sort of the routine things, but we really want to push you to work with your coach to think outside the box. And so this picture on the right makes me smile, and I put it in here because for all of us really to have a chuckle at, because I'm a crossword puzzle person. And so this made me smile that this person couldn't fill out the crossword and just decided to take their whiteout to task and make the boxes the way they needed them to be. Anyway, that's an example of the creativity you can bring to things. Another example would be if we were to talk about something very simple, like getting up to the second floor of a building. So if we were thinking sort of routine solutions, we would think about taking the stairs or taking the elevator to the second floor. But if we were going to stretch ourselves and think outside the box to solve that problem, we might think about things like climbing the fire escape on the outside of the building, or wearing a jetpack that could float us up to the second floor. And the nice thing about HOBSCOTCH is it lets you be creative. It lets you be innovative in problem solving. And that's what we want you to take away from tonight is this is about the issues that you're having from day to day. And you're really going to be driving the innovation of this program in the sense that you get to choose the problems you work on and the solutions you bring to them. So there are 7 steps to problem solving therapy. The first is for you with your coach to define a problem. And once you've done that, you'll work together to set a realistic goal, and then you'll go to that creative brainstorming of solutions. Once you have a list of solutions made, you'll consider the pros and cons for each of those potential solutions, and then you'll choose the solution that seems best. And together you'll develop an action plan to carry out that solution over the course of the next week. Then when you meet with your coach the following week, you'll review your progress, see how things went. And you always have the option of continuing to work on a problem if things weren't solved the first week. We have participants who might, really want to focus in on one problem. Sometimes even for the whole program, we've had people come and say, the problem that I'm having that bothers me the most that happens every day is the inability to remember names. And so they might spend several weeks walking through, setting goals and brainstorming solutions and trying different things until they find what works for them. Other people will want to work on a different problem each week. And because this program is driven by you, the person participating, either is absolutely fine to apply. I want to speak just a little bit about the memory toolbox. So the memory toolbox, and you can see a list of strategies that are found in the memory toolbox on the left-hand side. And these are really behavioral strategies that are designed to help people overcome problems with attention, memory, executive function, and other cognitive skills. And an example of one of those strategies listed there on the left is memory routines. And memory routines simply reflect doing things in the same way over and over again in order to prevent things from getting lost or steps from being forgotten. And so an example might be always putting your car or house keys on the same hook every time you walk in the door. That's one example. And what people can do learning about this type of strategy is try to incorporate things into their daily routines. And much like, the Olympic athletes, practice and patience and practice and more practice and more practice is what's necessary to get good at doing these things. And I want to share with you a case example of someone who came through the program, this lovely woman, Margaret, who was 43 and working as a hospice nurse. And she had for her job to, perform patient intake assessments at different long-term care facilities. And so she would often travel to 3 or 4 different buildings in a day, going in and doing assessments. And the problem she described having, which caused her a lot of frustration from day to day, was having to spend time searching for her personal items after completing her evaluations. So what she was doing was going into a building and, each building was different. And sometimes she would set her things down at the nursing station, and sometimes she would set them down outside a patient's room, and sometimes she might set them down in, someone's office. So she didn't really have a routine. So after thinking through her problem, this issue that was causing her both frustration and embarrassment because she recognized that people were noticing her, always having to look around for her things and help her look around for her things. What she did was find one common work area, and in this case, it was a staff lunchroom where she could leave her personal items, and it didn't matter what building she was in because each of them had a staff lunchroom. So she changed to make her memory routine fit into a common theme here. So instead of leaving things in different places, no matter what building she was in, she would go to the lunchroom and drop her things off so that when she was done her patient assessments, she always knew where her things were. She never had to ask anyone. She never had to sort of secretly search around to try to remember where she left her purse or her keys. And this seems like a really simple thing, but you can imagine that if your job was doing this, and every day for for years, you were going to 3 or 4 different buildings, and each time you did this, you had frustration at each one. It could really get to be very wearing. So a simple solution like this was really life-changing for Margaret, and it was lovely to hear that it was so effective for her. I want to share with you another strategy that we call the visualization or mental walk strategy. And so this is a strategy that your coach in the HOBSCOTCH program would teach you more about. And this has existed back from ancient times when it was too expensive to write things on paper. Students would use the mental walk, called the method of loci at that time, to remember things. And what it involves is thinking about a familiar space. And so for most of us, our homes are a familiar space. And so mentally, you would envision yourself walking into your home and through your house in a certain order. And so in this example, the person walks into their foyer, and from their foyer, it leads to the living room. And then from the living room, they imagine themselves walking into the dining room. So that's great. And that's something they do all the time, very easy for them to remember. The next step is then to take your list of items that you're trying to remember and place them in the different rooms you walk through. So in this case, what you can see is the person placed grapes in the front foyer and chicken in the living room and cherry pie on the dining room table. So that when they think about walking through their house, they would visualize walking in the foyer and seeing grapes, and then walking in the living room and seeing chicken, walking in the dining room and seeing a cherry pie. Now you take this one step further and take those list items and make them absurd enough that there's some humor and some emotion to them. So instead of just imagining a bowl of grapes sitting in your front foyer, you imagine your front foyer is filled from the ceiling to the floor with grapes. And you walk into your living room, and instead of imagining a chicken leg, maybe you imagine chickens running around your living room. And then you walk into the dining room and you visualize a cherry pie the size of the dining room table there. So as you're doing that, what you're doing is recruiting more areas of your brain by attaching an emotion to what you're visualizing, to the memory. And that emotion is humor in this case. And so that when the person drives to the grocery store, it will help them to remember the 3 things they went to pick up. They just have to imagine themselves doing this walk through their home. And this is a tool really that people get really good at using quite quickly. It's a strategy that, if you practice, you can go from lists of 3 items, and for some people may go up to a list of, close to a dozen items. So it can be a very effective way to remember things. And it doesn't just have to be a grocery list. It could be a list of errands that you have to run. So going to the dry cleaner, then the grocery store, then to get your hair cut. You could see how this could work for many different things. And it's a tried and true strategies that psychologists share all the time with their patients. And it could be something that your coach could help you to use to help you with some of the memory or thinking problems that you might be having. Another example revolves around reminders. And so most of us use some type of reminder in our daily lives. And essentially reminders are an external cue. And it's a term used for a memory aid, really, a reminder for someone to do something important. And they can be visual reminders, or they could be sound related reminders. So hearing a beeping sound, for example. There are many different kinds of reminders. And what's important is to choose the reminder that's right for you. And so I want to share one more case example of how reminders helped this particular person. So David, who lives with epilepsy, and Ellie, his sister and his primary caregiver, they're siblings that shared a home. And David worked as a custodian at a local school, and Ellie was retired but very active in their community. She was out and about often with her friends and going to museums and volunteering. And the problem the 2 of them were having was creating a lot of friction. So David was feeling very anxious when he would get home from work, and he'd forget where his sister had gone and when she would be home, even if she had told him in the morning before he went to work. And Ellie would come home, and if David wasn't home when he was supposed to be from his custodian job, you know, he would normally get home around 2:30. If she got home and he wasn't there, she would worry that something had happened to him. He had had a seizure and he needed help. She didn't know where he was. They confessed that neither of them were good about carrying their cell phones, and David did not like texting. He was not good at it. He didn't want to do that. And they tried sticky notes, but they didn't work consistently because David would often forget where the note was, or they got to a point where there were just too many sticky notes for him to keep track of the one that had the message for where his sister was. So after thinking through different solutions, they decided to set up a notebook with an attached pencil on a small writing table by their back door. It was the only door that they used to exit and enter their home. They tended not to use their front door unless company was coming. So this was a good, consistent place for a reminder to happen. And by setting up a notebook, if Ellie was going out with friends before David got home from work, she could leave him a note, you know, I've gone out for lunch, I'll be back at, 2:00, or I'm gone to the museum, I'll be back at 5:00. And then David would get home from work, he would look in the book and see where his sister was and when she would be home, and he would immediately feel relieved and not have that sense of anxiety. Similarly, if David got home from work and decided to go out and take a bike ride or walk the dog, he could leave Ellie a note, so that when she got home, if he wasn't home, she would know that he'd just gone out to walk the dog, that he was fine. It's not that he'd had a seizure and was somewhere and needed help. Again, a really simple solution, but it took time for them to think through what would work for them, what the right reminder would be, and to make that happen. Both of them described this as really having a huge benefit to their relationship. A lot of friction disappeared once they came up with the solution. I want to talk just briefly about quick relaxation that's included in the program, and it's an important part of the program. This mindfulness exercise really helps to relieve stress and anxiety for people. And we know that when we're stressed or anxious, it's harder to think. And so then it's also, makes sense that it's harder to remember things. And so quick relaxation is something that in this program, your coach will guide you through so that you can learn to do progressive muscle relaxation and deep breathing exercises, so it can become a daily stress relief for you, and also so that you can learn to implement it at times of high stress in your day to see if that helps you with your ability to think or remember things as well. I want to talk to you a little bit about some of the digital tools that are being developed with HOBSCOTCH. And so one is our website. We have a HOBSCOTCH website, and it's actually currently under revision, but will be ready sometime in the next 2 weeks to pop back up. And on our website, you'll find program details, you'll find education and resources. You'll find a way to connect with other people through a blog when the new website is up. And so we're excited to have this learning tool for people to use, and a place where they can ask us questions about the program as well. Another digital item that has come to be is something called the HOBSCOTCH app, and we just finished our beta testing phase. And so this will soon become available to participants as well. And so this is a phone app, and it can work on an iPhone or an Android or any phone really that works with apps. And what it does is it gives you a reminder to submit a daily log. And we purposely made it easy for people to use and not to take too much time. So it asks 4 simple questions. Did you have a seizure in the last 24 hours? Did you take all your medicines in the past 24 hours? Did you use a memory strategy, and how are you feeling? And this allows people to keep track of how they're doing with seizures, how they're doing with taking their medicines, whether or not they're utilizing the skills that they've learned with memory strategies, and just a sense for how they're doing. Included in the app is a calendar where you can keep track of your daily logs. And there's a place also where you can make short journal notes if you want to take in to speak with your doctor about. And there's an example here. Someone has written, I noticed some double vision that lasted for 3 hours after taking my new medicine. So this is a really simple tool to use. It was designed that way for it to be easy for people to use. It does provide you with a daily reminder each day to answer the 4 questions, which takes about a minute, just to do all of this. So we're excited to have this to share with people to help them keep track of both seizures and medications and their use of memory strategies. And, it's been wonderful to share everything I have with you this evening. And the reason that we're so excited about this program is because of what we hear back from participants. So quotes like this, I hope this program continues to thrive and touches people's lives in the positive way it has for me. We really have had very good feedback from people who have participated in the program. We've had excellent feedback from the coaches who've delivered the program. It's a really rewarding way to work with people. And certainly having a community partner like Naomi and the Epilepsy Foundation of Hawaii is a bonus. So you have a great partner in Naomi. I want to share with you just the names of my colleagues at the HOBSCOTCH Institute for Cognitive Health and Wellbeing. This is a program, as I mentioned, that we're all very invested in. Everyone here has compassion for the issues that people with epilepsy face when it comes to challenges with cognition and memory and thinking. And we're all very invested in working towards helping people improve their quality of life so they can live happier, more productive lives where they feel in control. And they're a great group of colleagues to work with. I just wanted to acknowledge them. And finally, I want to say thank you to Naomi for allowing me to share with you today. And thank you to all of you for your attention. And I'll pause here to take any questions if there are some.
If anyone has any questions, just unmute yourself. This is a great opportunity, so don't be ashamed. Ask away. Elaine, I guess I could ask real quickly about the target age group. Could you?
So this program has been developed and tested for adults. We are going to be adapting this program in the spring of 2021 to bring it to youth, to adolescents. And so we'll be excited to share that program with people in 2021. But this program was tested in people age 18 and above.
Okay, thank you. If anyone doesn't have any questions, I'm going to say my final thank yous.
Sure. And if people decide, that they think of a question later, please feel free to reach out. Naomi, you can always email. I'm happy to answer anything.
Sounds good. Yeah, if anyone else has further questions, you can reach out to myself, and I'll forward it to Elaine and get those answers to you. But if no one has anything else to say, I know she needs rest. Oh, it's been a long week for you, I know, and it's really late where you are. So I just really want to thank you for sharing your time and all this wealth of information that you have, and providing us the opportunity to offer HOBSCOTCH here in Hawaii as well. So we have 4 certified HOBSCOTCH memory coaches here, and we're looking to start. Anyone interested, give me a call, send me an email, and we'll get you started. But without any delay, I'd like to say good night, and thank you very much.
Thanks, Naomi. Have a good rest of the evening in Hawaii, everyone.
All right. Good night, Elaine. Take care, everyone.
Bye-bye.
Aloha.